Hi, everyone. Thank you for joining me today. My name is Emily Williams, and today I'm going to be talking about dialectics. Dialectics is a term in dialectical behavior therapy and has been around for quite some time through philosophy discussion. Marcia describes dialectical thinking or the dialectical process as synthesizing or integrating opposite ends of a spectrum. She believes that both opposites can be true at the same time, and there's a kernel of truth in every opposing idea. When we look at the kernel of truth, we help ourselves and we also help in creating healthier relationships. It can be a very, very important skill if you are someone who has a lot of all or nothing or black or white thinking. Sometimes it's okay to let go of the absolutes, the musts, the shoulds, and embrace the nuances and changes in life. Dialectical thinking is a pretty simple formula, actually. It is the thesis and the antithesis. And basically what that means is there's an idea and there's an opposite idea. And the synthesis of those two things is the dialectic. So for example, let's use colors because those are really easy to think about. So let's say you have black and white. The synthesis of those two things would be gray. You have red and white. The synthesis of those two things would be pink. But let's go deeper into that and let's look at more colorful life things. So let's say life is beautiful, right? And life is brutal. Maybe the synthesis of those things is life is brutal. That came from a TED Talk by Glennon Doyle Melton in 2013. Another thing to think about is something like having borderline personality disorder and not having borderline personality disorder. In other words, the dialectic here would be whether you have borderline personality disorder or don't have borderline personality disorder, there's way more to you than just a diagnosis. When we look at some of the skills that we talk about in dialectical therapy, one of the biggest dialectics that we talk about is wise mind. That is the synthesis between our emotion mind and our reasonable mind, where we access what our emotions are giving us information about and what our reasonable mind is giving us information about, and we come up with the synthesis. And this is the place where we find our intuitive knowing. It is also the reason why we use and not but. So if you are a constant yes but person, the yes buts is a person who rejects ideas by pointing out all of the potential flaws or by suggesting that the idea isn't good enough. It's interesting to think about that language that we use every day and how it can make a difference when it comes to our emotional health. Perhaps someone suggests to you, go for a walk, you'll feel better. If you're like most people, you might have responded something like, no, that won't work. I might feel better, but it will only last for a few minutes. Those little buts can keep us stuck in patterns that are not part of a life worth living. Committing to dialectical thinking may help us by learning to respond with something like, yes, I'll go for a walk. And if I feel sad again, I'll go for another walk. So it's moving ourselves from that yes, but thoughts to the yes and thoughts. These yes and thoughts can be very helpful because we go away from all the flaws of the logic, and we're not looking for the holes that come up. I'd like to share with you now some behavioral patterns that are common for patients who are enrolled in DBT therapy, and some of the highlighted things that we address. So give me just a second to share my screen. Now, I like to think of dialectics on a seesaw, right? So on both sides is the thesis and the antithesis. And oftentimes we see people will polarize to one side of the seesaw over the other. And so by looking at dialectics, we are trying to move towards the middle of the seesaw. So here you'll see self-acceptance and skill enhancement. So a lot of times in therapy, we will talk about the need to accept who we are, what our presenting symptoms are, and accept life as it is. Now we can accept, and also engage in skill enhancement. So sometimes people will focus only on change, right? Like we need to change everything. And then we forget the acceptance piece, which can be experienced as invalidating. When we accept the idea that we can have both acceptance of ourselves and work towards change, we can move towards the synthesis of that dialectic. Another common one is the problem solving versus the problem acceptance. So sometimes when we have a problem, it's really hard to accept that that is the problem. And because we get in that habit of not accepting what it is, we can't also move into problem solving because we're not accepting. And so the dialectic synthesis here is that we accept that there is a problem and also work on problem solving. Another one is the difference between affect regulation and affect tolerance. This is really highlighted in our emotional regulation unit and our distress tolerance unit. So emotional regulation means we're working long-term to regulate our emotions by addressing them when they come up. Tolerance means that when we have a big emotion, we learn to sit in it and endure it. So as we are learning to endure our emotions without trying to get rid of them, we're also learning how to regulate our emotions for more long-term care. So we can do both, and that's how we move towards the synthesis and balance the seesaw. Another one is the idea of self-efficacy, being able to do things on your own while also being able to seek out help. So some people will only seek out help and avoid gaining mastery in doing things on their own, while others will only do things on their own and feel like they can't ask for help. And the idea for the dialectic synthesis is that we can be both doing things on our own effectively and also ask for help when we need it. The next one is independence versus dependence. So this idea is that oftentimes we find ourselves very dependent on others, and we get caught in that system where we think we have to be just dependent. And other people feel like they can only be independent and they need to do everything for themselves. And the dialectical synthesis is there are times when you need people and there are times when you are able to go forth on your own. This can be seen in jobs, in families, and several other situations. So if you think about like being in the workforce and being dependent on somebody to help you learn a new skill, and then you gradually over time assert independence. And then once you become independent, you will also still need to rely on other people for help with things that you're not quite familiar with. The next one is transparency versus privacy. So some people will be completely transparent and say everything that's going on, and some people are super, super private. And the synthesis of these two is that there are times where you keep certain things private and other times when you are very transparent. And you can balance those two in the dialectical synthesis, in that you are transparent except for things that you need to keep private. Another one is trust versus suspicion. There are times that suspicion is healthy, in which that you have to be careful about certain things. And then other times when trust is healthy and you need to be able to rely on other people. And both can be unhealthy as well. You can trust people, trust at a time when it's not healthy, and you can have suspicion at a time when it's not healthy. The dialectical synthesis is that you have a healthy dose of suspicion when it is called for, and you trust when it is called for, and both of those things can coexist. Another one is emotional tolerance versus emotional control. So being able to experience a big emotion when it occurs and being able to sit with this is the tolerance. And emotional control is the ability to inhibit emotions when appropriate. Now, you can have both. You can have certain abilities to tolerate certain emotions while also having abilities to control emotion as needed. The synthesis would be that you both tolerate and control emotions. Another one is observing versus controlling and changing. So you can observe certain things in your environment or even observe things in your internal environment and see what's going on. And then on the opposite end is actions, where you're working to control or change the environment, internal and external. Now you can have both of these, right? Because in order to control or change, you will first need to observe. And in order to observe, you need to be able to have enough control to look out and really take in information. The next one is attending and watching versus participating. There are times when some people will only watch and some people will only participate, where sometimes the participating person needs to take time to attend to and watch what's going on, where people on the other end who are attending and watching may need to actually engage in some doing. That's the difference between doing and being, right? And so the synthesis between those two would be that you both attend and participate. The next one is the dialectical dilemma of giving to others versus needing from others. So some people tend to fall further into this spectrum where they need more from others, and some people fall more on the other end where they give more to others. And the synthesis of those two is that lovely give and take between individuals that keeps them in the middle and keep them synthesized. Another one is the dialectical dilemma of focus. Some people are very self-focused on what they need, and other people are very others-focused. And there is a dialectical synthesis here where you both focus on the self and focus on others. Another one is the contemplation meditation versus action. So contemplation meditation, you're looking inward, you're being retrospective, you're thinking about things, and the other one is action. So, and that's doing things. So at times you will need to contemplate and meditate, where other times you will need to take action. And you can see this too in like skill sets. Like oftentimes what is necessary is that you contemplate and sit with things, and other times action is necessary. And the synthesis is that you both contemplate and take action as needed. When doing these seesaws with patients, what we do is we look through a nice assessment of where one person lies over the other, and then we try to move more to the synthesis. And they can vary patient to patient, and they can actually vary from time to time with the same patient. So different people will rely on different ends of the dialectical spectrum depending on what the circumstances are. And as we look at how someone is responding, we often look at the antithesis of however they're responding in order to come to that synthesis. I hope this was helpful. There are some additional videos to help you understand dialectical patterns available in the YouTube channel. And I hope you have a really great day. Thank you for watching.